In this video, I will explain the responses to the epidemics in the 20th century, so since the 1900s, and you need to know about Spanish flu and AIDS. So a key point then, epidemics like Spanish flu and AIDS surprised the governments of the time. Reactions were swift and generally effective, and the media was used to get information out to people as quickly as possible as communications communications technology advanced. Right, so we see the factor of technology helping governments deal with epidemics. So let's have a look then at the Spanish flu. So between 1914 and 1918, 17 million people across the world died in the First World War. However, between 1918 and 1919, at least 50 million died as a result of a less well-known global disaster known as Spanish influenza. In Britain alone, it killed 228,000. It took more lives in 1 year than the Black Death had done between 1348 and 1351. So the disease is called Spanish influenza or Spanish flu simply because the first widely reported cases in Europe were in Spain, but it struck almost every nation on earth. By early 1918, it was rife in the trenches of Northern Europe. Soldiers then spread the infection to Britain when they returned on leave. The first wave in Britain lasted from June to July 1918. It then died down before surging back for its most devastating attack from October to December. It reached its peak just at the end of the war on the 11th of November as people celebrated in enormous crowds. It faded again but returned between February and May 1919. The symptoms of Spanish flu caused great alarm. It would start with signs of a common cold or flu, such as chills, high temperature, headache and pains in the back and limbs. For some, the symptoms stopped and there they would survive. For others, it turned into a vicious attack of pneumonia. Blue patches and dark spots appeared on their cheeks, indicating that the body was struggling to get enough oxygen. They might have bled from the nose, ears or stomach as they fought to take in some air. Someone could be healthy in the morning and dead by tea time. No one knew what caused the Spanish flu. Practical experiments and new discoveries about germs meant that people used face masks to avoid breathing air that might have been infected with the breath of flu victims. We now know that Spanish flu started as a virus that affects birds. This jumped to infect humans, probably in the Far East. It was then carried to Europe by labourers brought from China to work in the army camps in France during the war. From there, the disease ran riot. We still do not know how to cure influenza today, although there are vaccines that offer some protection. A new flu virus could attack the world at any time. For our scientific advances, we would still be largely defenceless. So an important person then associated with the Spanish flu is somebody called Dr. Niven, and he was Manchester's medical officer, and he wrote a really thorough report. So, as we know, in 1875, during the industrial period, there was the Public Health Act, and this required each town to appoint a medical officer. And in 1918, the medical officer in Manchester was Dr. Niven. And he worked tirelessly to write a thorough report on the Spanish flu. So he kept detailed records of each flu victim's case and looked for patterns about who was affected, when and where. He praised the efforts of the nurses and doctors who risked their lives by treating the sick. He sent health visitors door to door to record on special cards who was ill and what help they needed. For example, did they need coal for fuel or did they need food? He referred to records of earlier severe flu outbreaks, arranged for extra grave diggers to be appointed, He published detailed advice in newspapers. He recommended to the government that they must invest money into researching colds and influenza. He visited factories and schools to see for himself how the disease first affected its victims and to advise on how to avoid it. He used his medical contacts to try a new flu vaccine, which unfortunately didn't work. He urged the council to shut all schools, but it was slow to follow this advice. He insisted that theatres and cinemas could only stay open if they had good ventilation and were disinfected between shows. He issued flu advice leaflets insisting on regular hand washing, using a handkerchief and wearing face masks, for example, when on buses. And he arranged for a film about the flu to be shown in cinemas. He used simple language to give the public advice, for example, spit kills. So Dr. Niven's determination to limit the spread of Spanish influenza in Manchester seems to have worked. 2,000 people died there, but the proportion was much higher in cities such as Glasgow and London. In his report, Dr. Niven said that, in future, people might expect greater protection from public health officials like him. So we can see some similarities there between previous epidemics, such as cholera, and such as the plague as well. And the importance of scientific research, of writing reports, mapping out who was infected, using the media and technology to spread a simple message about washing hands, wearing face masks. So the next epidemic that you need to know about is HIV and AIDS. So in the 1970s, doctors in Europe and North America and Africa encountered a strange new medical condition. Victims suffered from pneumonia, severe weight loss and sores on their skin. Their bodies wasted and they died. No one could explain this, and it went unreported in the media. Then in 1981, 5 gay men in Los Angeles and 1 in Britain died from the condition. It appeared to be caused by a problem with the body's immune system. In 1982, it was given the name AIDS, Acquired Immune Deficiency Syndrome. And the response to AIDS can be sectioned into 5 phases. So phase 1, we look at the 1970s to 1983, and where we see growing awareness of the condition. So by 1982, 7 people in Britain had died from AIDS. Friends of one of these set up the Terrace Higgins Trust to raise funds for research and raise awareness of the illness, but very few people shared their concern over AIDS at this stage. The media first took an interest in 1983 when a number of people developed AIDS after receiving blood transfusions. And the government urged gay people and drug addicts to stop donating blood. One newspaper even ran a story about killer blood in British hospitals. And soon afterwards, 2 television documentaries about AIDS were made. So this early reporting of AIDS started to raise concerns. And many people pointed out that AIDS was not like cholera and the Spanish flu, as it could and should be avoided if men would refrain from having sex with other men and if drug users would kick their habit. And even some church leaders preached that AIDS was God's punishment on gay people and drug addicts. Phase 2, then, growing alarm. So this was mid-80s, so 84 to 85. So people were unsure how easily AIDS could spread and they overreacted. So for example, some fire service staff stopped giving mouth-to-mouth resuscitation for fear of infection. Some churchgoers refused to share the cup from which someone drank wine at the service of Holy Communion. Parents withdrew their children from a class where one pupil acquired HIV through a blood transfusion. There was no risk of getting AIDS from any of these situations, but at the time it was not made clear. People's fears increased in 1985 when the Royal College of Nursing wrongly predicted that Britain would have 1 million cases of AIDS by 1991. The government caused alarm by ordering hospitals to detain patients with AIDS even if they wished to leave. Doctors and visitors had to wear gowns, masks and gloves, which reinforced fears that AIDS could be spread by the slightest contact, which is completely incorrect. So phase 3, the next phase, we see a growing understanding. This is 1986 to 1987. So by this time, more helpful actions were underway. Charity groups, including some run by churches, provided clean needles to drug addicts to reduce cross-infection. The government funded free testing for HIV at hospitals and the screening of all blood donations, so blood transfusions were now safe. The government also organised an AIDS prevention campaign. It sent a leaflet called "Don't Die of Ignorance" to every home in Britain and ran advertisements on television on how to avoid contracting AIDS. There was television programmes, poster campaigns and radio phone-in shows which helped to end the myths about how AIDS was spread. The real breakthrough came in April 1987 when Princess Diana, the most famous and popular member of the royal family at the time, visited a clinic and made sure the news reports showed photographs of her shaking hands with someone who was suffering from AIDS. People were reassured that AIDS could not be passed by simple contact and that those who suffered from it deserved compassion and respect. This takes us on to phase 4, where we see a growing acceptance. So this is 1988 to 95. So the late 1980s and early 90s were years when AIDS became more widely understood. In 1991, a storyline was included in the BBC television series EastEnders about a character who was diagnosed as HIV positive. In the same year, the enormously popular rock star Freddie Mercury died from AIDS. In 1992, a tribute concert and a special release of one of his greatest hits raised around £20 million for AIDS causes. This would have been unthinkable a few years beforehand. AIDS was spreading, but at nothing like the rate that had been predicted by the Royal College of Nursing. Measures to make blood transfusions safe and advice about safe sex and not sharing needles was working. By 1995, about 25,000 people in Britain had been diagnosed HIV positive. 12,000 of those had developed AIDS, and around 8,500 of these people had died. So our last phase of the AIDS epidemic is 1996 onwards, and this is where we see growing complacency. So in 1996 came unexpected news. Scientists had devised drugs called antiretrovirals that delayed the onset of AIDS in people infected with HIV. These were very expensive, but the government funded them. This was very good news, but it had also unexpected consequences. The government relaxed its campaigns about AIDS and HIV. Many people believe these antiretrovirals are a cure for AIDS, and that this had led to complacency. Instead of falling, cases of HIV infection, as well as a range of other sexually transmitted diseases, have risen alarmingly in recent years. In 2009, there were about 100,000 people in Britain living with HIV. Of these, 40,000 were gay men, and the rest were heterosexual men and women. About a quarter of all these with HIV are not aware of their condition and may be spreading the infection without knowing it. Far from helping to end this epidemic, the discovery of an effective treatment seems to have made it worse.